Good afternoon, everyone. My name is John Lohr, and I'm the Administrative Associate in the MCW Office of Community Engagement. Welcome to the May edition of our monthly series, CE Spotlight. We will be taking a summer break. We'll be taking a break for the summer, and we'll be back in August for our second season of our CE Spotlight. Please note that this session is being recorded. I would like to begin with a statement from the Office of Community Engagement. We wish to acknowledge the Indigenous people who are past and present steward the land on which we pursue our just cause of a healthy community for everyone. To our audience members, please make sure that you are muted throughout the presentation. We encourage everyone to use the chat bar freely to share comments, post questions for our guests. We will be monitoring your questions throughout the session, so feel free to send them as they may come to you. We also will set some time at the end for Q&A. Please look for more information about our upcoming guests on our CE website. You can find our series webpage by Googling MCW CE Spotlight. This month's series features community partners and the important work they're doing for and with the community. We highlight their goals, motivations, accomplishments, and the way they partner with the people and program at MCW. Today, we are deeply honored to have Castro as our featured guest. We will also like to thank Dr. Ryan Spelisi, who is serving as facilitator today. At this time, I would like to introduce Christine Ziegler, our program manager in the Office of Community Engagement, who will say a few words about our important work for the community and his partnership with MCW. Christine?
Thank you, Jai. It is my pleasure to say a few words about Mr. Alberto Castro. Alberto, Al, is the program director of the Health Research Department at the United Community Center in Milwaukee, having served in several leadership roles there since 1994. Al has a master's degree in business management from Cardinal Stritch University and a bachelor's degree in social work from Carroll University, and he is a Wisconsin licensed bilingual social worker. Al has over 45 years of experience as a social worker for human services programming, including child protective services, juvenile, adult, and teen parenting services, and nonprofit community services. He has been a field placement supervisor for many undergraduate and graduate social worker students from local universities for over 30 years, as well as mentoring public health and medical students involved in public health field experiences. Al leads and manages the work of UCC, which is a community organization serving young children to older adults through various programs in the areas of childcare, education, youth prevention, substance abuse treatment, elderly services, dementia care, low-income housing, fitness, health, and neighborhood development programs. He serves as the primary liaison or co-principal investigator in community health research projects with local universities and is responsible for developing and maintaining partnerships for effective community engaged research in the Latino population of Greater Milwaukee. Al is a co-author in various publications related to community health research projects and is responsible for managing research and health services projects via subawards from federal, state, academic, or foundation sponsors. Prior to his current position, Al had been the program director of UCC's Latino Geriatric Center, which was established in 2007, and recently led the establishment of a mobile memory clinic program to expand earlier detection, diagnosis, and care for Latinos in Milwaukee. He is currently helping with the development of a new dementia care initiative to establish a 4-county regional consortium that will expand the use of telehealth services to improve access to timely and culturally appropriate dementia care. Al currently serves in leadership roles in the Milwaukee Latino Health Coalition and the Wisconsin Department of Health Services Minority Health Advisory Committee. I will now turn our presentation over to Kelsey Heindel, Program Coordinator in the Office of Community Engagement. Kelsey will introduce today's facilitator, Dr. Ryan Spellacy.
Thanks, Christine. Dr. Spellacy is the Ursula von der Rohe Professor of Bioethics in the Center for Bioethics and Medical Humanities at the Medical College of Wisconsin, where he is also the Assistant Provost for Research and Director of the Human Research Protection Program. His work focuses on research ethics, ethical issues in psychiatry, character in medical education, and community involvement in research. He advised the Patient-Centered Outcomes Research Institute regarding engaging stakeholders in the peer review process and the Association of American Medical Colleges on IRBs and community-based research. Recently, he was the co-PI for an NIH-funded national study evaluating a novel, easier-to-read consent form for blood and marrow transplant trials. And he currently leads a project to create a community-engaged research ethics training program, as well as a study to evaluate the strengths and barriers regarding cancer clinical trial participation in African American churches. Dr. Spellacy, thank you for serving as our facilitator today, and I turn the mic over to you.
Thank you, Kelsey, and thanks, Al, for joining us and everyone else for joining us as well. We'll get right into it, but please, as Jai mentioned, if you have questions, throw them up in the chat and we'll get to them. We'll keep an eye on it. So Al, first question, tell us a little about yourself, if you would.
Do this in Spanish or English, by the way? Español or English today?
Both, please.
Okay. We'll be here till 6. Well, thank you. Thank you, by the way, for inviting me today to all my colleagues at the Medical College of Wisconsin. And thank you for all the audience that are joining me. I see a lot of names I recognize here, so I better be on my best behavior. About myself, well, as Christine mentioned, currently I'm the Director of Health Research Programs. But my background is a lot in social work. I've been a social worker, I think it's about 1976, I believe, and mostly around the Metro Milwaukee area. A lot of my background has been in nonprofit and county social services. A little bit about myself. I'm a Mexican-American background, born and raised in South Texas. We moved here in 1966, I believe it was. Come from a small family of 13. Most of my family lives up in the Green Bay area. I'm the only transplant down here. Married, have 2 kids, and a whole passel of grandkids in the area here. And love my job at UCC. I'm glad to share today what I have the opportunity to do here today.
Thanks, Al. Next question's kind of a 2-parter. Okay. Could you tell us a bit about how you got involved with the UCC and then how you got involved in the research area of the United Community Center?
Yeah, it's been an interesting path. It's been an interesting path. I first came here in 1994 to help run the what we call the youth prevention programs at that time. We were doing home-based interventions with the kids that were involved in alcohol, drugs, runaway behavior, truancy, et cetera, like that. Coming from a county government background where I was a child protective worker for many years, it was nice to have an opportunity to work directly with the Latino community, using my language and be able to do more prevention work, you might say. So I really enjoyed the experience here at UCC, and I found a home. I've got great friends here. So that kind of, my first go around here was in direct services with families and kids. I left for a few years to run my own organization for a while, came back I think in 2008. I was invited to help lead the Latino Geriatric Center that Kristen mentioned. I fell in love with the place, the design, it fit our culture, our community. If you ever have a chance, come visit us. And my father was going through Alzheimer's disease at that point. So it was a kind of it came together at the right time. So I helped manage that geriatric center since I think 2008, and really enjoyed the experience of helping develop a program from the ground up to where it is now. But in 2013 is when I was able then to get more into health research, and I didn't know what I was getting into. At that time, a name that we all know, Said Ahmed, had already been working with my predecessors, Rene Farias, Ricardo Diaz, our former director, and Angelica Delgado Rendon, who was our health research coordinator at the time, to develop some health research projects. So by Said and his staff reaching out to us, people like Zeno Franco, David Nelson, helped to develop that relationship, I guess. And I had some projects that we got involved with health research and really perked my interest about what the research world was about, because in direct services, in social work, we're directly working with families and kids, elderly, but we're focused so much on the here and now and reducing the crisis, dealing with the problem, but never much chance to get at those, what I call upstream factors. So as Renee and Angelica got us involved more into these research projects, I started liking what I saw. So when things changed here, Renee left, Angelica had left, so they passed the health research projects to me. So by that time I was still running the memory clinic. So you know how it works in nonprofits. Here's a little more for you to do without taking something else away. But it was a good challenge for me. It allowed me to develop what we now is a full-time health research department, along with my coordinator and interns that we use. So it's kind of been a step wading into it with my toes first, and now I'm up over my neck and things like that. So that's how I got into the health research activities here with Medical College and eventually with other universities, Madison, Marquette University, Carroll, and UW Milwaukee. So it's kind of a sideways entrance into health research.
Thanks, Al. You already mentioned a bit about some of your partners at MCW, Zeno Franco, David Nelson, Saeed Ahmed. What's it been like to partner with MCW?
I was thinking about that question when I saw it. It's been a process. It's just like any other relationship. And I can only go from when I got involved, 2011 or so. It's been a very respectful, mutual benefit type of relationship. It's been an eye-opener for myself and my staff, having to learn about human subject protection and the difference between research and direct services. We've had some very good solid projects that we've done with folks that we just mentioned. Elaine Drew comes to mind. We did a Dulce Tentación, which is a diabetes telenovela in Spanish. We've done falls prevention programs for the elderly. So it's been starting small, you might say, which is a good idea back then. We didn't get into major, big project at that time. And I think that was probably intentional and probably fortunate too, because it allowed our UCC staff to get our feet under our ground, on the ground underneath us, and learned as we went along. I would also have to say that it's been a bi-directional experience for both of us, for us and our medical college partners. They've learned from us and we've learned from them. We've been treated as equals at the table. Probably the overlying theme is being treated as experts and as consultants, something that we usually don't get approached in the past in the nonprofit world. But yeah, we are experts in our community. And so being approached and seen that way with respect for mutual benefit has been I guess we describe the relationship with Medical College. And secondly, it's opened other opportunities for not just myself and our organization, but it's also opened opportunities for other community partners. We've been able to bring other organizations who kind of trust us to also get involved in research projects with us and the Medical College. It's also opened opportunities for some of our younger staff who have cut their teeth here in preliminary research and have gone on to pursue advanced degrees in health research. And Heli Delgado comes to mind. Dr. Rendon, she works for you folks now. We've had other people move on to get on their PhDs or masters in public health. So it's also been good for the staff themselves too.
Great, thanks. I think this is a related question. You talked a lot about some of these projects. Through that, what have you learned about what it takes to be an effective partner? And I suppose you could address that either on the community side or on the researcher side.
Okay, that's a good question. I'll start from the community side, and then I'll talk about from the academic side. I guess from the community side, what we've learned is to get informed, to get ourselves educated, find out what this term health research is, right? and what is informed consent, what is human subject protection, because we have to be able to understand what you folks are talking to us about. So we could, common language, you might say, to provide staff development opportunities for our staff to get them up to par so they can also be equal people at the table when we're talking about health research terminology and concepts. Learning how to effectively write grants in a different method than just writing for foundations. We're all very good at that, but helping to learn how to write research grants and research language has been quite the learning curve for us, but we're there, we're getting there. Also the importance of what data collection is about, different kind of data we collect for services. So we've had to learn about the importance of evidence-based data collection. Probably another one is to be able to present our community as asset-based. Our communities are pretty resilient, no matter which part of the community we're talking about in Milwaukee. Most time the media and you read the news, it's all sorts of deficit. What's wrong with our community? Our organization and other organizations that have been here for over 50 years can stand testament that we can be resilient. Our residents, our community, our organizations, our businesses, we have something to offer. And so I think as a community partner, learning to bring that perspective to the table when we're talking about a research project is not just look at the negative, what's in place already that we can build on and bring that into the design of the research project. So again, going back to seeing ourselves as experts, to be that voice for our community. That's a big responsibility as a community organization. We're being asked to be research partners because we have to both be community providers, right? Because we are service providers first, but now we also have to talk the language and advocate for our community in the world of research. So being able to see ourselves like experts and be able to bring that voice and walk that road between service provider and research team. So that's been a learning experience from us. Yes, for the past 13 years, I would say it's been enjoyable also being able to mentor and guide young researchers, even experienced researchers, on what it means from our side. And to show that I have some visual examples that I sent to Christine that might help kind of visualize what the points I'd like to share with you folks. When people approach us for do community engaged work, to us, it's like asking us, you want to meet my family, right? And we're very dedicated. We're very concerned about our community. It's our passion. And our community puts a lot of trust in organizations like UCC. We've been here for over 52 years now. So we have a certain responsibility to our community and our residents. So yeah, maybe a little protective, you might say. So yeah, that's kind of the concept I would want to use. So if you go to the next slide, Christine, I would say that, and this comes from a model that Dr. Adams did out of Madison. Understanding that community engagement is really a dynamic, progressive process. It's not just a stop and go, here and done. If you've not worked with our communities before or are just beginning to, keep in mind that different organizations are at different stages. Some organizations are grassroots organizations, very small. They may not have the structure to do some intense research. Some might be that middle level organizations, they've been there for a few years. They might be have more professional staff on board, and maybe they've got more data, more programs to offer, and the ability to get involved in some limited research activities. And you get more mature organizations such as UCC that have been here for a while and have more expertise of professional staff and facilities to be able to help out. So that's from the organization side. From the academic partner, I would ask you to keep in mind that this is a good example of a progressive process that Dr. Adams describes. One is no engagement, you haven't met each other yet. The next stage would be when you meet somebody, it's an initial contact, like when you first gonna meet our family, right? You wanna meet my daughter, well, you gotta meet with me first, right? Before you can start dating my daughter, right? So let's have that conversation first. Then usually what tends to happen if there's agreement then to proceed with a project, there's that initial piloting work that's done. As you're most familiar what a pilot project is. So be able to explain that to the community organization, what a pilot is, because remember, we're service directed, we're service oriented. So trying to explain, we're going to do an experiment, we can't serve everybody, do a good job of explaining why that is. Obviously, if it leads to the next stage of an extended partnership, like I was describing with medical college, it can lead to research opportunities, and not just one, but other opportunities, and that's the actual research. Hopefully that relationship goes well and it's successful. Everybody walks away with mutually beneficial results. Bi-directional benefit has happened. Then you advance to the stage of full partnerships, which is not just in this model called for expanded research, which is true. It can open doors to more research opportunities or other organizations get involved, but it also leads to a full long-term relationship. And I think on my next slide, Christine, I think I can mention that. I just want to call out what the community expects from community engaged research when you come to us. We expect to be treated with respect and ethically. That goes without saying. The other one is a key one, and things are changing, I know, and that's why all of you are in this call. So let's talk to the people who are not in the call, that we don't want to be test subjects. We don't want to be guinea pigs, okay? That's the old days, what we call helicopter research, I think used to be, they call the term that. We don't want to be that. We have assets, we have experience here, and our community is valuable to us. Our staff are valuable, our time is valuable. So respect that we do have assets and experience to bring to the table, and we can share the learning. We can teach you, you can teach us, which is called co-learning. The other thing to keep in mind is when we're being approached about a research effort, be conscious and clear about what the time and effort that's going to be required of us. In social work, we have to call this social exchange theory. That basically says how much time I'm going to put into your request, what is it going to cost me, what's my benefits, and if it's not worth it, can I get a better deal from somebody else, you might say, okay? So keep in mind that you may have the greatest theory, the greatest project, but if it doesn't have value, or I guess value to the organization, you're not going to get past the front door. The other thing we look for is explaining, yes, that this is research for this purpose, but explain to us how we can use the data or the results to see how we can change things in the community, what we do or other organizations do that can lead to more observable change that can be sustained. And always empower us to build our own capacity, whether it's that health issue that's being studied or future health issues. Look to see how your relationship that you develop as a community partner can help empower that capacity for the organization themselves. So it's not just the capacity just to stay with the research team. The next slide, I think, covered the process. It's a process, as I mentioned in the other slide. And really, the first stage is, it's introduction. And go out, meet us, find us, get introduced by other colleagues, like the people on the call here, Ryan, Christina, Kelsey, they know about us, Erica, and there's other organizations probably say the same thing too. In other words, don't come to us with a project already set up and say, can you find me 200 people? Here's a flyer, can you find me 300 people? That's not community engagement research. So set up a time to come out and meet us, get oriented to what our purpose is, what your purpose is, spend some time, invest some of that time to get to know us. Too many times organizations get this request 4 days before the project, the application is due, and they need a letter of support. Can you quick get a letter of support for us on this? And we have had a conversation, we haven't met you yet. That's not being respectful of our time and our needs. The next stage would be negotiating what's the project going to be like. So sit down with the community partners, ask us before you write the proposal. If you wrote it, are you open to adaptations? So involve your partners in the proposal development. Obviously, share the work and the money. If you get the grant, then when you've written the budget, hopefully you put money in there to compensate the community partner for the time that they're going to be putting into it. And this is where the real work really starts, as you know. Always be looking to see how the research effort can build a capacity to partners, teach us your interventions or help us understand what you're doing, and we can help you out. Above all, share the talent, the time, and the treasure that you as researchers bring here, and we can also share our talent, time, and treasure for mutual benefit. As with any relationship, things are going to change, right? People will come and go, so be prepared for that. Some nonprofits, they have a higher turnover, retention issues. or maybe there's just transfers and moves like anybody else, or maybe you might have to change a project. So be prepared to manage those changes in a joint method. There's going to be disagreements. We've had disagreements with project partners in the past. So sometimes we have to reconcile those differences or maybe modify the intervention to meet the need of what the community is saying. And when the project's complete, celebrate with us. Join us in the reflection and involve us in the dissemination. So many times after a project is done, the research team will go off and do their presentations and they don't always bring the community partners with them. We like going to conferences too. We like doing webinars, so involve us in that too. Okay. And the last one I want to finish with this is beyond the research project, plan on sustaining that relationship, because you may need us, or we may need you in the future. Continue that relationship in different ways until something else comes up, or stay involved in other ways. Different organizations have different ways that you can get involved. I think that's it, right? I think it's one more. Oh, why all this important? Because folks, you only have one chance to make a first impression. So if you don't come into the door in the right way, you're not going to get past the front door. So I like this little guy. He said, well, perhaps I should just leave a flyer. He obviously didn't call ahead. Okay. So that's kind of a quick synopsis, I think, of what community and partners expect for community engaged approach.
Thanks, Al. I think you already covered a lot of the next question, but thinking about some folks on the call that might be interested in getting involved in community engagement. You already mentioned this about show up, come find us. But how can people effectively engage with the community, and how do you build the relationship that you just described in that last slide?
Sure. If you're not from the community or look like the community, yes, it'll be a challenge, and we all know what that's like. So go out of your way, or use your colleagues, use your mentors, use your faculty, use other researchers to suggest, who should I talk to in this neighborhood? Who are those voices? Who are those represented? And sometimes it's not always the professionals. Sometimes it's the non-professionals that'll be your voices. They can connect you. So try to find out how you can make that entrance or that connection to the community, rather than a cold call or just a cold email. Try to use somebody in between, or try to find out as much as you know about the community from others. Because you never know if somebody already did some similar research in that community, and maybe it bombed, okay, and it left a bad taste in somebody's mouth. So find out where you're going first, and use you. In medical college, you have a great office, a community engagement office. You have people right there who can kind of guide you in that. Another method is develop that relationship with community partners to help them be your co-investigators, be your ambassadors on the ground. Because people that look like the community and work in the community will be able to open those doors for you. So that's why I say, before you write the proposal or finish writing, reach out to see who can be that boots on the ground, who can be your ambassador, who can be your co-researchers out there to help you connect with the community and talk with the community, help you recruit in the community, and then if necessary, depending on the project itself, teach the intervention to that community partner so they can help you carry it out. So there's different ways you can use your partner, but and then be aware that they may say no. Okay, so it's not an appropriate study for us at this point, or the timing is right. Something happened in the community and we're not open to that right now. And that's okay. Be ready to ask where else to go, or recommend somewhere else, and not push it, you might say. Because remember, our primary purpose our mission is to serve people, not to do research. So you have to kind of keep that in mind. So you have to do a good job of selling how the research is going to help us do our job better and more effectively with the data and the science behind it.
Great. So we've been talking about basics of community engaged research and interacting with the community. Let's get a little more specific. What do you see as challenges in getting Latinos to participate in research, and how has UCC helped bridge that connection?
Sure. Well, until recently, they weren't being asked. Most research, as you all know, tends to be more with the white community. They're just a larger population. And most research takes place in big cities or areas where there are not many Latinos. So first of all, just just not being strategically thought of back in the old days, right? Now there's more effort to reach out to communities of color, which is great. However, just like other population groups, Latinos have had some negative experiences with outsiders coming into their communities to do services, to do programs, to even do research. So some of those memories are there, and some of those issues might still be around. So that's why I say it's important to find out where you're going, who you can talk to. Then there's the language barriers. It wasn't that long ago that most research documents, flyers was all in English, right? And then people were asked to use volunteers to interpret or somehow figure it out. So the language being used to approach the community has been a barrier. And even if it is in Spanish, you might say, sometimes the barrier might be in how it's written, the literacy level. We talk about that a lot in our projects here, that we have to be accounted for the literacy level our population had. Not everybody has high school English capacity. Or even if you speak Spanish, we may not be able to read it necessarily. That's what you need the community partners really to advise you on just the initial planning, the flyers of recruitment, things like that. Secondly is Latinos will not, it's depending how acculturated, assimilated we are here in this country or in this state, we may not be that open to an outsider coming into our community or our school or in our homes to do research. So if asking somebody local like ourselves to be that connector, to be that co-researcher, to be that whatever title you want to use as your ambassador, to open that door. So partnering with your local organizations is another way to open those doors. Another point is, especially in our community, we serve a low-income community, very focused on work, paying the rent, paying the house payment, putting groceries on the table, paying for your kids' school, get gas in the car. Very basic to above basic level needs is the focus of many of our low-income community. So trying to get them to think about taking time after work to come to a focus group or on a weekend, it's a challenge. It's not in the scope of their daily work. So that's why you need somebody from the community to help explain that to you and help you, I guess, prepare and send that message, whether it's verbally or in print or media, whatever it's going to be. It's just where the people are getting the basics needs met, and they may not be appropriate for your studies. So just be prepared for that. The other thing is many of our folks might be coming from either countries or background where health prevention was not something that's in their world, because it didn't exist in the country that they're from, or maybe in the neighborhoods, even in our own country here. And even if it was, it might not be prevention that is typical modern medicine. We have curanderos, we have shamans, we have maceteros, we have holistic medicine in our communities. That has been our health prevention and our health care. So that sometimes can get in the way too, or could be a barrier, or needs to be accounted for. Another one is this feeling that we're a very collective society. We look after each other, our community. We look after our own family members first, and really don't want to rely on outsiders coming in. And if somebody has to step in from the outside, it's almost like, what's wrong with you? Couldn't you do this by yourself, type of thing. So it's those kind of things, that nuances that you probably don't, it's hard to put a finger on, but it's there. And that's where your community partners can help kind of quote translate that for you and talk to the community about that. There's probably other things, but we don't have enough time. But those are some of the examples that I've seen and my partners have seen here. It's kind of a challenge.
Okay. Shifting focus a bit, how has COVID-19 affected your work and your community?
Big time. Like everybody else, it was a shock for us, right? We had to temporarily shut down for a couple of weeks, couple of months, I think it was, back in 2020. I think we shut down in March like everybody else. But by I think late May, we had to keep going. Like many community organizations, we cannot shut down forever because our community still needs us. So by summer of 2020, our leadership had come up with plans to slowly provide some programs and gradually add other ones. Come up with safety protocols, equipment for the building and safety equipment. And some programs could not be done in person. Some just had to be suspended for a while. Some were converted to virtual telehealth. So it did impact us in direct services in some programs, like our elderly programs. They could not come here, they're most vulnerable. But some programs were able to switch to and be able to do virtual classes, virtual sessions. So it depended on the program. You saw the pictures in the slide in the beginning. We're a multi-service agency, so it's not a one size fits all. So we had to kind of figure out which program it worked and which one it didn't. And we gradually did start bringing people back. I think it's in the fall of 2020. We were doing combination virtual classes, in-person classes for our schools. Some programs we're still seeing clients virtually. So depending on the program, I guess if anything, it affected us in ways that we learned how to adapt to this, adapted to helping our teachers, adaptive teaching style, their teaching methods, whether it's virtual or in person, virtual services for some programs. Telehealth has really become a thing in many of our programs here. But it also, I guess we learned that we're resilient. Us and other organizations figured it out. We've been figuring it out. We're still not out of it, as we all know, but it did impact us temporarily, but anything's been a learning process for us. We're finding out that technology that we were not using before can be a benefit, and we're adapting to that. For our research projects, yes, it impact us. We cannot recruit directly, we cannot do interventions directly, so we had to figure out with our research partners how to modify some of the work we were doing, and some had to be suspended temporarily, or the researchers applied for kind of a grant, or what it's called, NSO grant, to modify the research to do it more virtually, things like that. So it impacted even our research projects, and we're slowly coming out of that. We're able to now be able to do more direct recruitment and intervention with our partners. So again, depending which program it impacted. And the other thing, I guess, it's also brought other people to the table. I've seen other people more in a good example is the state of Wisconsin. They really invested in vaccine community outreach programs, something we had not done directly before. It was new to us too. So it's impacted our work in that we're able to obtain a couple of grants where we're out there doing community education about the vaccines, about protocols, even doing vaccine clinics. So it's added a different dimension, you might say, to some of the work we do. And it's brought new partnerships to it that we didn't have before. For example, we were partnering with Hyatt Pharmacy to do vaccines. We hadn't done that before. We're working closely with the Latino Medical Student Association for the Medical College of Wisconsin. They're out there volunteering, helping us get the word out about the vaccines, volunteering at the clinics. And we've developed a new partnership with the National Association of Hispanic Nurses. They're volunteering, helping us with the promotion of the vaccine and helping at the vaccine clinic. So that's just one example. It's opened doors to other relationship partnership that we didn't have before.
Thanks, Al. And you've talked a lot about the UCC and your work there, and that it's not solely focused on research, all these different things like the vaccines you were just mentioning and the like. How can people support your work in your community?
Okay. You can go to our website, www.unitedcc.org, and I think somebody had the scan code in there before. You can get involved in several ways. Volunteers, either as individuals or as groups. You can donate funds as a group or an individual, or you can get involved as volunteers as an individual or as group volunteers too. We also take internships, various programs, various departments in our agency. It's a place for internships. And you don't have to speak Spanish in all of them, depends where it is. And employment, we're always, if you look on our website, we also have open positions like other people. These are professional and career advancement type of positions. So the ability to work here, I think, is a great opportunity too. So those are some of the ways. And then the other way, I guess, was today's topic is reach out to us when you're thinking of a research project before you start writing anything down. Okay, get us involved early on so we can help you put your concepts together and be of mutual benefit.
All right, thanks. Last question. What would you like people to know about your organization?
I guess I want to share our vision statement. Our vision is an empowered and thriving Hispanic community where all achieve their fullest potential. We've been here since 1970, folks, and we're not going anywhere. So we've been trying to accomplish this vision for 52 years now. And you saw in those opening slides of various programs and services that we have. We try to be a multi-service organization to meet the needs of the community. So we don't try to bring in things that the community doesn't want or need. So we listen to our community and our advisors and our board of directors on how to respond to the needs of our community. So whether you're trying to build your wealth or your health or your education, buying your own home, other outcomes, we're here to help with that process. So we invite you to come visit us. We're open, come visit us, stay for a while, and get to see what we're doing here at UCC here on the South Side. We're right in the heart of the Latino community. We're a nonprofit organization. We have about, I hope my boss is on the line. We have 500 employees at UCC. We just hit that milestone here. That's the first time in our history. So we're celebrating that. We've got 500 employees carrying out the work of our organization compared to the 40 or 50 when I got here back in 1994. So we're here to stay. We're at 1028 South 9th Street. Come see us.
Thanks a lot, Al.
Thank you.
And with that, we'll open the chat to questions. I guess I should also note that you're not only open, but you have a restaurant, Cafe El Sol.
Yes, we have a Mexican Puerto Rican restaurant downstairs, Monday through Friday, and Big Fish Fry on Friday nights. And we have music, and yes, we can also host meetings here too. We have small conference rooms that we can have small meetings and conferences here too. Mm-hmm.
Yeah, I've been to and hosted a number of meetings there, and it's a really nice one-stop shop. You can get food from El Sol brought in, catered. It's fantastic.
Margaritas at the bar.
Well, not during the noon conference, but sure.
Yeah, open to questions, please. Are they allowed to go and use their microphone? Because I'm not good at chat here.
I'm watching it. Sarah just asked, thanks, Al. What are some examples of research issues that the community you serve would be interested in?
When we think about some of the health issues we're dealing with is child development. We now have a early learning academy. I know it's in the picture, one of the pictures that is shared there. It's a Head Start program, so anything in the area on how we can better prepare our little babies and our little children for life, whether it's health or education or social circumstances. So this is a new area for us. It's a pretty big program. So it's anything with early childhood development that would be of value. The other area, as many of us know, is diabetes, heart disease. Those are big issues in our community, high blood pressure. We are always looking to learn more about what we can do about dementia and dementia care in our Latino community. And I would also say anything in the area of preparing our young students, our young children, for the adolescent years that are coming ahead of them and the adult years, on those skills that they're going to need to withstand the pressures of adolescence, as we all know, for healthier adolescent, healthy children.
Thanks, Al. Tracy asked, what community engagement project that you've been involved in has been the most meaningful to you?
I better answer this one, right, because she was my funder on one of them.
Clearly it was AHW funded.
That's a fixed question, Tracy. It would have to be two of them. I can't pick one or the other. One was we did with Dr. Judy Kim. We were testing a retinopathy camera in the community, looking for diabetic eye disease in the Latino community. That's a big issue in our community, and our folks don't get screened early enough, and yet we have high rate of diabetes. So by the time they would come to see Dr. Kim, the vision was pretty far gone. So she was able to get us a couple of pretty cool cameras, high state of the art, where we were able to take it out. She showed us how to use them, and then in turn we took it out to the community. So we were able to catch quite a few people with symptoms of diabetic eye disease that they wouldn't have caught earlier. That was a very gratifying program because it was our staff doing the screening and our community partners. And so that's an example of building the skills here. And then now we transferred to the health department. So they are now running that program. So that was one that was a very valuable, but it was also an enjoyable process to be able to use this cool equipment and catch the disease early. The other one I think that I always highlight is Elaine Drew's project that we did. That was the Dulce Tentacion. That was Angelica Delgado Rendon was very involved. That was her project with Dr. Drew, where they developed a soap opera in Spanish to educate the Latino community about what diabetes is and how to recognize the symptoms, what you can do about it. But it was folded into an actual soap opera using community members to play themselves as a family that was dealing with the issues and denying it, and then how it affected the family. And we use that method many times. We use that DVD many times, and we're looking to resurrect it again. So those are the two that pop up to me that I think from the community side was the most impactful, and I really enjoyed those. The one personally for me was with you, Dr. Spellacy, where we were able to work with you and the IRB staff to create an alternative to training community members as community partner members in human subject protections. We developed a classroom model rather than the modules that you folks have to do on the website. We developed a model where it's actually classroom based, and you're able to discuss and use examples and be able to design it and practice it and then put it on the website. That was, for me, it was a personally gratifying experience to be able to work with some new friends at the IRB office. Yes, opening doors to community research.
Yeah. Mirta was part of that as well. Yeah, no, that was great as well. And the folks from the IRB that were involved in that project still talk about it to this day. It was really good for my IRB folks to get out into the community and see the community engaged side of things, not just, the submissions that they process and review. So thank you. Sarah asked, can you give some examples of ways that you communicate research results back to your community?
Sure. I'll take Dr. Kim's example, for example. And even the telenovela was Dr. Drew. We have the ability to either organize a group of the participants themselves in one of our rooms. We have many rooms here. We have an theater type of thing. We did it in the auditorium for a larger group. So we can we have the ability to convene our community to bring them here, and a research team comes out and talks to them and presents the findings. They've been large projects, they've been small projects. So we will gather people from that target group. It may not be the participants themselves, but other people that might be ready. So we have that ability, and we've done that several times. We don't put much in the newspapers because our folks don't read that newspaper. It's more in person, having you come back and talk to our community. In some cases, talk to our leadership staff about the results of the project.
Great. We got a question from Leopoldo. Hello, Mr. Castro. Do you have any ideas on how we can overcome the fear that some Latinos have toward doctors and hospitals, mainly from the undocumented population?
Boy, has that been an issue in the past number of years, hasn't it? And it's not just doctors, it's just anything trying to participate in the census, coming to us, things like that. Probably similar. If find somebody, organizations in the community who can be that go-between for you to be able to inform and educate those people about what the hospital has to offer, what the doctor has to offer. Find an ambassador, a connectors that look like them and talk like them to be that go-between, because they'll have the credibility. It's a real fear. It's a real fear, people. I mean, it was not too long ago, people were disappearing here in the raids, things like that. So that memory is still here. So find yourself organizations or partners or church leaders who can help you be that messenger, to make that connection for whatever the issue is.
Okay. We got a question from Christine. Do you link up and share challenges and successes with other centers outside of Milwaukee, Wisconsin that serve Latina communities in other states or regions?
That can vary. Last night I was a keynote speaker, fortunately, on the first Latino Upper Midwest Alzheimer's Conference.
Wow.
So there was the first one, and they asked me to speak about what I'm sharing some of this tonight, for example. So those are opportunities like that. We have been presenters at other regional conferences or local webinars, national webinars on some of our projects and programs here. So yes, there's opportunities, but many times it's because somebody like you mentions us to them. Because UCC is a primary Milwaukee County serving organization. We're not a national organization. But we're glad to talk to anybody if you send them our way. But yeah, we've been able to do that. This couple federal grant that we just finished, there's a Orange County Alzheimer's Association is looking at one of our program models to use on how to train their staff around dementia with who have intellectual disabilities. So we developed a training program. So we're sharing those results with them, consulting with them. So yeah, we can go statewide too. But again, our primary focus is Milwaukee County, but we'll talk to anybody.
Thanks. And we might have time for one more question. We're about 1 minute from the wrap up. So if anybody has one last burning question, please throw it up there. If not, I'll ask a quick question, Al. Oh, nope. I will go. Alexis has a question. I'll let her ask it. So she thanks you for the wisdom and learning you've shared. Do you have any insight as to how to title your community when writing grants? Latino, Latina, Latinx, or Hispanic?
That's a good one, because that conversation is still being had in our community and it's not settled. My advice is ask who you're talking to. How do they want? So don't assume we're all going to use the same term. So depending on which organization you're talking to or what target group, ask them how they want to use it. For example, at UCC, we're still using Latino, Latina, but that's us. If you're with the organization, you might use something different. I know we're confusing you folks, I know, but the conversation is still in process and it's not settled. So like anything else, ask first. So that's a good thing. Good question. Ask first.
All right. Thanks very much, Al. And I think we've got our closing slides coming up. But just a reminder to thank you again for joining us for this. Appreciate everybody's participation and great questions that you asked. A reminder that we are taking off the summer for this program. But if this presentation inspires you, please consider donating and or volunteering to support the United Community Center, and you can scan that QR code for details. At the very least, make sure you hit Café au Sol. And I think we have one more slide. Yes. So thanks again for supporting this, our first season of CE Spotlight. And please mark your calendars for August for when the series will resume in its second year of the Spotlight, the CE Spotlight series. So thanks to everyone that participated. Special thanks to the staff that made this happen, both Christine and Jai, and huge thanks to Al Castro for spending some time with us today and sharing his wisdom and experience. It's always a pleasure. Thanks, Al.
It's a beautiful world out there, folks. Let's keep it that way, okay?
Thank you.
Thank you all.